Welcome to another session of the midwifery procedures. My name is Kwesidia Ofe from College of Nursing and Midwifery, Nalegu. Today, I'll be taking you through baby bathing and cord dressing. Baby bath and cord dressing is an initial process of cleaning the newborn baby. It is usually performed within 6 to 24 hours after delivery, irrespective of the condition of the mother. However, initial bath is delayed if the baby is critically ill. The aims of this procedure is to maintain personal cleanliness, prevent skin infection of the newborn. It also enhances comfort and relaxation of the newborn baby and promotes positive interaction. It also induces sleep. It enables our babies to sleep very well, and it offers opportunity for health education to the mother. It also offers us the opportunity to examine our baby. Thank you. The requirements for baby bath and cord dressing includes a trolley. You need a trolley with a top shelf and a bottom shelf. Then 2 large towels. Then a cord sheet, baby cord sheet. Then you need 4 face towels, 4 smaller face towels. A diaper. Baby welcome dress, which includes baby cap and then socks. Then you need a clean tray. A clean tray. I have with me here a kidney dish with its lid, and inside is sterile. I have a cord scissors inside, a sterile cord scissors, and then a cord clamp, a sterile. This is a galley pot with its lid. and I have a distilled water or well-cooled water soaked with sterile cotton. Then I have a garlic pot with its lid with spirit inside for cord dressing. Then I have chlorhexidine. So you either use, if you are going with spirits, you use the spirits with cotton wool swabs, or if you want to use the chlorhexidine, then you use it with a dry cotton. So you don't use both. If you are doing the cord dressing with chlorhexidine, it should be chlorhexidine alone. However, chlorhexidine is now recommended. I have with me here a sterile glove for cord dressing. This is a kidney dish with sponge and then baby soup. Then I have pomade, baby pomade, brush or comb. Then you can add powder depending on the hospital protocol. Then a kidney dish as a receiver. So these are two containers with water, cold water and then cold water. The pink one contains hot water, and then the green container contains cold water. So I'll put this in my down shelf of the drawer. Then we have a basin, a smaller basin, and then a large basin for baby bath. Then a receptacle for used clothes. You need a flat surface for the baby bath or a bathtub. So we are going to use the table. It is flat, and we will spread our broad Macintosh on the table to protect the surface. Good morning, Madam Jennifer.
Good morning, Madam Ness.
How are you?
I'm fine, thank you.
We thank God. How is baby?
Baby is doing well.
Oh, okay. My name is Sibia Ofe. Today I'll be helping you to bath your baby since your baby is up to 24 hours after delivery.
Okay.
Madam Jennifer, this will help your baby to stay calm, help your baby to sleep well, and keep your baby clean. And even the cord dressing it will help the baby. It will prevent cord infection and also help the cord to dry well. Okay. Please, can I have? Do you have some of the items for baby bath?
Yes, please. I have some items here.
Okay, so let me have them. Thank you. Madam Jennifer, can I help you? Okay. Okay, Madam Jennifer, you can come along with me so that you observe how the baby bath is done and the cord dressing. This will help you when you go home to also know how to do cord dressing. So you can please come along with me. Now, we are about to start with the procedure, and we have the items ready. Before you start with the procedure, baby bath and cord dressing, it is important to keep a conducive environment during this procedure. This means that you have to keep a very neat environment, well lighted, and also a warm environment. So you need to close your doors and windows, off fans and AC if available. You also need to maintain infection prevention techniques throughout the procedure. So before I get started, I will don my apron. After hand washing, you then mix your water. You mix your cold and hot water. So make the water plenty here because you need to immerse the baby's body inside the water. So make the water. Okay. So you have to test the temperature of the water. We need a bath thermometer to test the temperature, but we don't have a bath thermometer, so you can use your elbow to test for the temperature of the water. Okay, It's fine. Okay, the temperature is fine. So if the water hurts you, burns you so much, would tell you that it will be too much for the baby. And water should not be cool either. So it should be in between. Spread one large towel over the table or a flat surface. And your call sheet. So you can spread your call sheet this way. You can fold it this way. So for examination purpose, you might not get support. So make sure you put your things, your items closer to you, because you might not get the chance to ask your examiner to help you out. So that's what I'm doing. Spread your second large towel on top of the cord sheet. At this moment, you can go for your baby. Madam Jennifer, can I have your baby? So this baby has never, this is the first bath, so I will use glove. Assuming it's not, the baby had taken her bath already, I would have used my hands. So I'm just using alcohol rub, then I don my examination gloves. So for baby first bath, I will don my examination gloves. I'm going to unwrap the baby. Make sure you do not expose baby. Cover baby as much as possible. Okay, so I'll drop this into my receptor. So I'm cleaning baby's eyes from the inner contour of the eye to the outer contour of the eye. Then I clean the other eye from the inner contour of the eye to the outer contour of the eye. When you clean baby's face with a damp towel, please don't make the towel so wet. Make it somehow wet. Then I'll start from the upper part of the face. Then I clean. Then when I clean, I change the area of the towel and clean. Then I change the area of the towel, clean. Then I'll clean towards the ears. I'll start with the baby's hair. So this is how I'll support my baby. And then I'll support the nape of the neck and clock baby's ears with my 2 fingers, like this. And rinse baby's hair thoroughly. So I'll dry baby's hair with a dried towel. And quickly wear my baby cap. This will prevent baby from getting cold. Then I'll start with the rest of the body. So I'm going to start with the neck and concentrate the folds of the skin. Then I'll bath baby arms. And I'll concentrate on the folds of the skin. Make sure you cover up baby. To prevent hypothermia. To the legs, concentrate on the folds of the skin. And then from here, I'll bath the baby's back. I'll support baby's chest with my arm so that I can bath, so that you can bath the back of the baby down to the feet. Then from here, you immerse baby's body into the water, our bigger basin, with the head above the water. So I am going to still support my baby's neck, nape of the neck, and clock baby's ears with my 2 fingers so that water does not go inside our baby's ears. So immerse the baby inside the baby's body inside the water with the head above the water and rinse thoroughly. Then you dry baby's body with a small towel. So make sure the diaper does not cover the baby's cord. Expose baby's cord for cord dressing. So we're done with the baby bath, and normally this procedure follows up with cord dressing. So try to expose the cord, the area of the cord, for cord dressing. Cord dressing is a sterile procedure, so you need to wash your hands and don your sterile gloves. But before then, you need to open up your sterile tray, because after donning your sterile glove, you might not be able to open it up. So I will quickly open up my sterile kidney dish, which contain cord scissors and then cord clamp, and then also open up my sterile cotton. And if it is chlorhexidine that I am using, I will open it up and place it here. And then also, if it's a spirit that I'm using, I'll quickly open up. This is to ensure infection prevention. So I'll then go and wash my hands. Cord dressing is a sterile procedure, so make sure you don't your sterile gloves. Jennifer, I'm about to dress your baby cord, and with this procedure, when you go home, you will have to always dress your baby cord once in a day. So please pay attention and ask any question after the procedure. So I am going to use chlorhexidine to dress your baby cord. When you get home, you need to always wash your hands before dressing your baby cord and air dry them. After washing your hands, you need to air dry your hands. Do not use any napkin or any face towel to clean your hands before applying chlorhexidine to your baby's cord. So I am going to demonstrate it to you, so that when you go home, you can take it from there. Thank you so much. So kindly pay attention as I do the procedure. Thank you. So after donning my sterile glove, I will hold my cord clamp with a dry cotton and examine the cord for any loose cord clamp or cord ligature or any bleeding around the cord. I'm going to dress my cord with chlorhexidine 7.1%. So I'll open the seal and spread chlorhexidine around the stump of the cord. I'll use my index finger to spread the chlorhexidine all over the cord and allow the cord and expose the cord to dry. Okay. Without chlorhexidine is now recommended for cord care, but without chlorhexidine, you can dress the cord with spirit and cotton. So you don't do the same procedures, and at the same time you choose one, but chlorhexidine is recommended. With the spirit, I will first of all soak my cotton wood in the spirit. Then I will hold the stump of the cord. I will hold the cord clamp and then continue to clean. I will clean from the base. I'll start from the base of the cord and I'll estimate 5 centimeters away from the base of the cord and then clean round. Then I'll clean from the base upwards in stroke. From the base up. And then clean the tip of the cord. I'll then expose the cord to dry. Thank you so much. I'm done bathing your baby.
Thank you very much.
Thank you so much. So during the bath, I didn't see anything that is alarming. Baby is fine. So I will encourage you to always breastfeed the baby. Continue breastfeeding. Okay, thank you so much.
Thank you very much.
And also, Madam Jennifer, if you go home and notice any redness around the base of the cord, discharges, pus, or any unusual thing, kindly report back to the hospital. So from here, dispose of or decontaminate used items. Make sure you wash your hands with soap and water and document your findings. Record into the maternal and child record book and communicate your findings to the officer in charge. This comes to the end of the procedure, baby bath and cord dressing. Thank you.